Bladder cancer is more common in men than women, and trying to figure out why this might be the case, one of the things that's been hypothesized is that perhaps testosterone is the cause. That is, maybe testosterone increases the risk of bladder cancer. In fact, there was a study published last year, in 2023, that did not show any indication that TRT raised the risk of bladder cancer. Now, this study was only observational, and therefore definitive conclusions can't be made. But it did make me want to look at the matter more because I couldn't really remember much data on this at all. So I did a complete review of the literature looking at papers dealing with bladder cancer risk related to testosterone. In point of fact, I could find very few papers at all and no reviews on the subject. I could find only two studies examining the relationship of naturally produced testosterone and bladder cancer. Both are observational and with conflicting findings. One study examined whether testosterone was associated with the incidence of bladder cancer and concluded that there was an increased risk, even if it was small. The other examined whether there is a relationship between testosterone level and the aggressiveness of bladder cancer tumors and concluded that there was no effect of testosterone on the aggressiveness of bladder cancer tumors. In regard to testosterone replacement, in fact, there are no randomized controlled trials examining this issue, and the only other study is the one I mentioned previously, which is observational in nature. Another way of examining the risk is to look at studies of the effect of androgen suppressive therapy, or AST, on the risk of bladder cancer incidence, progression, and mortality. There have been several studies looking at two forms of AST, PD5 inhibitors that block formation of testosterone's potent metabolite DHT, which is currently used for prostate enlargement and hair loss, and androgen deprivation therapy, ADT, as is currently used to treat prostate cancer. In fact, a meta-analysis of these studies has been published, and the results suggested that AST may improve bladder cancer incidence and outcomes, but because these studies were observational and no RCTs were available, the authors concluded appropriately that AST may represent a potential strategy aimed at reducing prostate cancer incidence and improving the risk of recurrence of bladder cancer, but that further well-designed randomized trials were needed to validate their preliminary results. Bottom line, first, based on current studies, the case can be made that testosterone may increase bladder cancer risk, but there's no definitive proof that such is the case at the present time. More importantly, perhaps from a practical standpoint, is that because the underlying risk of bladder cancer is so small, even if a significant increase in risk occurs on testosterone therapy, it is not likely the kind of risk that is going to deter most patients from pursuing it. For example, a very large recent study demonstrated that in smokers and non-smokers, the incidence of bladder cancer is roughly equivalent to less than 0.2% and 0.04% respectively per year. Over 30 years, that would give you a cumulative incidence of less than 6% and less than 1.2% cumulative risk in smokers and non-smokers respectively. Further, except in the extreme elderly, most of these patients will not die of their bladder cancer, which is also lower in non-smokers. So even if testosterone therapy doubled the risk, this would increase the risk roughly to less than 0.4% and less 0.08% per annum in smokers and non-smokers respectively, and our cumulative 30-year risk increasing to less than 12% and less than 2.4% respectively, and the risk of dying likely to be less than 6% and less than 1% respectively, testosterone increasing the risk less than 3% and less than 0.5% respectively. Current scientific evidence simply does not allow for definitive answers, and clearly what we need is randomized trials looking at testosterone replacement therapy's effect on bladder cancer incidence. In the meantime, I hope this was helpful for you.